Hello, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Breanna Janovy, who is a CSW-PIP, and I did look this up because I didn't want to screw it up, certified social worker in private or independent practice, right?
Correct.
Yay,
yes.
I got it right. Well, welcome, Breanna. I'm glad to have you on the show.
Thanks for having me.
And I'm really happy to find out just how local you are. Good heavens. You're like Sturgis royalty, practically.
In a sense. But yeah, I graduated from Sturgis Brown High School and went on to start at Black Hills State University for college. Ended up transferring and graduating from University of South Dakota. Went and worked for a couple years and then decided to go and get my master's in social work.
Okay. Why did you choose this, Breanna? This is a topic where the profession that you do, you get so intimately involved with people's lives. Mm-hmm. What is appealing about that for you?
Mm-hmm. It's amazing to be able to walk alongside someone on their journey. And as they figure out things about themselves, or maybe work on or work out different problems or things that they've been through, processing, it is an amazing journey to allow or have someone be so vulnerable that they let you walk alongside them.
Does it? I can imagine the satisfaction and the feeling of fulfillment you could get from that, from helping these people too that need it. Mm-hmm. Does it ever get overwhelming sometimes, though, for you personally?
It can at times, yes, and that's where we often it used to be a catchphrase, maybe it still is, that self-care piece.
Of course.
But we have to be aware of our reactions as well when we're working with someone.
Well, the reason why we wanted to have you in for the podcast today is we were talking a little bit about this before we started recording, that it seems like just recently, or in my perception recently, that mental and physical health hasn't been utilized together to heal people as much as I think it should have been for years and years and years and years. Mm-hmm. But it seems like we're getting this kind of new awakening in how this all works. Is that how you see it too?
I believe so. It's coming more into the now about how everything is connected. Yes, we have our mental health, our physical health, our nutrition, how we're sleeping. It is all connected. And we're seeming to learn more and more about that all the time.
Well, when I got the email for this podcast, there was a line in there that had mentioned talking about mental health is physical health. Mm-hmm. And that's a simple statement, really. But in your practice, that really seems, it seems super important.
Mm-hmm. How we're doing physically, if we eat a lot of junk food, we might not be getting maybe enough protein or enough things to keep us fueling before we, say, run on empty. Mm-hmm. So how do we support ourselves physically, whether it's nutrition or, someone's not getting enough steps in or moving enough, then you might be more tired.
Right.
As funny as it sounds sometimes.
Right. Yeah, exactly.
The more you move a little bit, the more feel-good hormones in our brain release, and that helps us improve our outlook, improve our day, even if it's just something very small.
Well, and I suppose another big part of this, and I think which is kind of a big crux of this podcast too, is the stigma that goes along with mental health. Mm-hmm. When you have physical issues, those seem to be, okay, my arm hurts, I got to go to the doctor. I'm not feeling well, I got to go to the doctor. But you don't hear a lot of people in an office setting say something like, God, mentally I just feel off. Mm-hmm. I'm not there. I want to go see somebody, right? And so they don't talk about it. And then in a lot of instances, they don't go and get help. Mm-hmm. That's kind of where I'm assuming you come in as well with these people to say, look, it's just as important as your physical health, correct?
Mm-hmm. Yes, mental health is very important. It plays a role in us and how we're doing, and how do we work on connecting or bridging that gap. You have a broken arm, might need a cast, you might need to go see somebody. If you're not doing well, if you're angry a lot, or if you're really sad or feeling hopeless, down, depressed, or maybe you're going through a tough situation and you're not handling it well, you're not acting like you typically do, maybe that's something to come in and talk to somebody about.
Why is that so hard to get past in a lot of people? Why can't we go, I got a stomachache, I go to urgent care. Mm-hmm. I'm feeling down, depressed, sad, anxious. Why don't I go seek mental health care too? Why is it so hard for us to do that?
Mm-hmm. I think it's very hard for people to be vulnerable.
Oh, I suppose that's the key right there, isn't it? But I'm sitting down talking to you, right? There's nobody else in the room. Why is that? Why is that any different? It is something I've thought a lot about. I can go in and sit down and talk to a doctor, and it's fine. Why can't I sit down and talk to you about how anxious I felt today? Where's that line?
Well, maybe you're more comfortable and have seen your doctor more often.
Sure.
Maybe I'm a stranger you've never met before, and there's probably some fear in there too that you coming to visit is you have to share everything the first visit. That's not true. That is not true. It's okay to take some time to build a connection with the therapist, the counselor. It's okay to figure out whether you think you can trust that person, and then let's figure out some goals and things that you are wanting to and willing to work on. So making it more human. It's not as scary as our imagination and emotions tend to make it.
Well, and I suppose the more we talk about it, like on podcasts like this, then maybe more people will realize, well, hey, I should give it a try. It shouldn't be as scary as that. Great point, though, in that you see your doctor, at least once a year, just for regular checkups, but you don't go see a mental health doctor at all in most people's lives ever, correct? When it comes to what you do, how do you work with Monument Health then? What's your connection there with them?
I've been working at Monument Health for over 5 years now.
Okay.
I started off at our inpatient psychiatric unit, Monument Behavioral Health, and recently transferred over to outpatient. So my role now is mainly outpatient services. People can schedule appointments with me, come in, walk in, just like you're going to a doctor's appointment. If there's someone that's having a rough day and say they come into the urgent care or the primary care clinic, also in the same building, if they're having a rough day or having a crisis and I'm able to come over and talk with them, I can try to help de-escalate, just see, is there anything you need that we can help connect you with or get you right now? And hey, are you interested in following up on this?
Right.
Maybe these are some things we could work on, or do you feel that you need more help than just right now? So
if somebody goes into an urgent care right now that's connected with Monument, that option is available?
Right now, I'm currently in Sturgis.
Okay,
so
got it.
If someone comes into the Sturgis Clinic, I can see them outpatient, schedule appointments, or if they go to the urgent care or primary care and I don't have another patient with me at that moment, and they can give me a call, staff will give me a call, and I can go over and talk with them. Are you seeing a noticeable pickup in this? Are people utilizing this that are aware of it? I'm getting called over by staff. It seems more and more often. Okay. More and more often. So if someone comes into the urgent care and they're having a crisis, extremely down, extremely sad, tearful, and that's not normal for them, the staff can call me, hey, Breanna, can you come and talk to them, please? And we can explore that further. So trying to get the word out that, in the Sturgis Clinic, I am able to do that. I absolutely love this. Having grown up in an era where you didn't talk about your mental health, you toughed it out, right? That was the whole reasoning behind it. To go in with a physical hurt, which in some sense can be mental, and have that ability to say, or even the staff to recognize, which I think that's pretty important too, that the staff that are working on nurses and doctors also have to kind of understand, hey, this is more than just, ouch, this hurts, right? It can be. And it can be tough to identify too, especially if, as humans, as we are, we don't always know, like maybe we're feeling a little off or irritable. Yeah. But how do we know when that becomes a problem? Boy, that's a good question too. I'm so glad you guys are on top of this right now. So have you noticed, have there been some good
noticeable outcomes to this approach? Are you seeing people leaving the hospital or leaving urgent care or leaving the clinic with a better understanding? And maybe can you look at them and be like, oh, they do feel a little bit better. That did help.
Mm-hmm. It's amazing. And part of the conversation with the therapy also is checking in.
Yeah.
How are they doing? How do you feel about this? What progress do you feel like you've made? Do you feel like maybe you're getting stuck somewhere? And thinking, and figuring out, working with them, how do they feel about it? And then, yes, at sometimes if someone starts off as severely depressed and you're working with them, you can maybe see a little bit that they're getting a little bit lighter.
Yeah. Okay.
And
how do you handle people that you know there's that problem, but they're not going to open up about it, they're not going to talk about it? What are there tricks you can use to get them to open up a little bit? Because you have to recognize it. You have to see that, yeah, it's there. This is more than just your physical hurt. Mm-hmm. But I know you don't want to talk about it.
Well, we working with resistance.
Yeah,
it's very interesting how intertwined it can be. I'm okay talking about this, mm-hmm. but I don't want to talk about that. All right, so maybe we pull out motivational interviewing, and that is a way of communication. What is maybe holding you back? What is stopping you from making changes or wanting to make changes? Mm-hmm. Okay, and then I also hear, you're wanting to work on this, but yet you also still have the side, you're ambivalent.
Right.
So let's do maybe some motivational interviewing to kind of pick that apart a little bit. And how can you use where you want to go, where you want to be? How do we try to help get you there?
It seems like people want to talk, even when they say they don't. Mm-hmm. And it seems like that, like I said, I don't want to call these tricks. They're not tricks that you're using. You're just able to tell that, here's how I think I can get this person to open up. And usually it seems like when they do, mm-hmm. they've wanted to this entire time, right?
Maybe there was something in them that was like, yep, I need to talk about it out loud, maybe outside of our own head.
Right, exactly. Mm-hmm. So then what advice do you give for someone who might be hesitant to seek this kind of help? Mm-hmm. I'm sure you get that question a ton because there's probably family members or friends that see that these people do need help. They can't break that wall. So what advice would you give to people like that?
Mm-hmm. I think doing self-reflecting, some mindfulness can get you started. If you want to work on making change or are willing to work on making change, come in. Let's figure out how to help you make that change. There is also nothing wrong with going to see someone new for therapy, for counseling. It's okay to take a little bit of time to decide if you like that person in a sense of, okay, do I feel like I can trust them? Do I not? Do our personalities click okay, right? We have to build that therapeutic relationship rapport is what we call it. And it's okay to not like that person. Mm-hmm. It's okay to go find someone else.
Right.
It's not personal. So I feel it's very important to let people know that you're not stuck with just that one person. There are more out there.
Do you ever feel like there are people that have maybe come to you a few times and then stopped and you felt like, oh, I was so close. I could have helped them, but you just didn't click. Mm-hmm. Does that happen occasionally?
It does happen occasionally. And then also at times people sometimes think, well, I'm going to be in therapy for a long time to work on this. Right. But maybe it was more of a short-term thing that maybe they just needed help getting through the moment or a specific time.
And I think that's another really good point is that people think, oh, if I go see a therapist, I'm locked in once a week for an entire year. And I think you can have these short-term outcomes that help people, correct?
Yes. Short-term therapy, it does not have to be forever. And that's something you talk with the therapist counselor about. That is something, let's what do you think about trying this? Let's try this. And do you need more support in this, this time frame? Is it a special anniversary of someone that passed or anything like that? Let's get you feeling supported or connected. What do you need? So it is fairly flexible.
Now, yes. do you do stuff outside of the hospital too? Can people see you, make appointments to see you as like a regular therapist, or do you only work within the confines of like Monument and people that come in for other issues? So
I'm currently within Monument, but people coming in to see me, that's the outpatient part.
Okay. Got it. Excellent. Breanna, I really want to thank you for coming in and talking about this stuff because I do think, like we mentioned when we started, that people just don't know that a lot of these services are available. That, like they say, you go in to see your doctor, you're hurt, part of it could be mental, and you just go home without fixing that mental part. You fix the physical, and that seems fine, but I think there's people that sit there and think, God, if I could have just talked to somebody really quick about whatever was wrong, then maybe all of me would feel better, right? And so now just knowing that this service is available, in Sturgis specifically, because that's where you're based out of right now, correct? Yeah. I think it's a wonderful thing. I think this can be a game changer in medicine for sure if we can have people start talking as well.
Yeah, and that's, I think, one of the hardest pieces.
It is. It totally is. You're right.
But it can be very much worth it.
Excellent. Breanna Janovy, certified social worker in private or independent practice. I don't like that last part on there. I just want to say you're a certified social worker that's changing lives. How about that?
Well, that works. And some states make it easier to say licensed clinical social worker.
Oh, that's better. Okay, come on, South Dakota. Well, Breanna, thank you very much for coming in. I appreciate it.
Thanks for having me.